5 in your health, more local towns are at high risk for mosquito-borne diseases. Here to talk about that, it's Friday. It's Dr. Simone Wilds, an infectious disease specialist at South Shore Health. Always good to see you, Doctor.
Hey, Dr. Wilds, great to see you. Happy Friday. So we know that cases of West Nile and Triple E are rare, but there have been 4 now new cases in the past week. Are you worried? Will we see more? Is this concerning?
Well, Ed, I must say, I think unfortunately we might definitely be seeing a few more cases of West Nile and Triple E. I think part of the reason we're seeing these increased cases might be due to climate changes where we have shorter winters, we have longer summer with warmer temperatures, and our rainfall, that has changed, which if you have more rain, then of course you're going to be breeding more mosquitoes. I think, however, the good news is as soon as we get the first hard frost, then I think the mosquito population is going to decrease. So I said more than any time, we're all kind of looking forward to the first hard frost.
All right, let's take a look at the latest risk map. Do you think that the towns in the red and orange areas, in your opinion, should reschedule Friday night football games and other outdoor events?
Well, Maria, I think given the data that we're seeing right now, I'm in full support of the towns and communities that are rescheduling their football games as well as other outdoor events, really because we're trying to protect everyone. You can have the games in the mornings or afternoons. Really, safety is really the most important thing. But in addition, if you're going to be outdoors, I want to encourage you use insect repellent. And of course, wear a long shirt with long pants and long socks to protect yourselves.
But as we say many times, when it's 90 degrees out, it's not easy to get dressed with long sleeves or long pants or cover everything. But covering in the repellent is a great reminder. So, Doctor, I want to ask you this because we've had few viewers ask a question. Why are there vaccines to protect horses from Triple E and West Nile, but nothing to protect humans? What's the answer to that?
Ed, that's a great question. You know why? Because we actually do have a human vaccine for Triple E, which has been developed since the mid-1980s. However, it's not really available right now for public use. There is ongoing clinical trials, but not available for the public. It's not FDA approved.
Not available
at this time.
Not available yet, but likely to be.
Hard to say, Ed. I mean, I think we have to get the clinical trials further along.
Dr. Wilds, great to see you. Be well. Thank you, Doctor.
Thank you, Dr. Wilds.